welcome back to Nurse Justin. My name is Justin. In today's video, we're going to be discussing all the things you need to know about ABGs, why they're important, how you do them, and how do you interpret them. All of those things will be discussed in today's video, so stick around and hopefully you'll learn something today. Alright, let's jump right into ABGs here. So I have some things pulled up here for us to discuss here on my whiteboard about ABGs. Let's first break down ABG. ABG, arterial blood gas. No, we're not putting gas into the artery. No, we're not drawing gas from the artery. We're drawing blood from the artery. And we're going to analyze that blood into normal blood gas values as seen here in the bottom left. All of these images here were just simple Google searches to pull these images up, to pull this all together to make things simpler for you. This video is going to hopefully help the nursing student or the basic new nurse understand ABGs and why they're important and how to interpret them. So why do we do an ABG? That's a great question. So ABGs are typically done to evaluate respiratory dysfunction. But ABGs can also be drawn for other reasons, not just to interpret respiratory function. Some type of overdoses, metabolic disorders, organ dysfunctions can cause alterations in your ABG values that you're going to see here on the left-hand screen. We're going to break down these values, we're going to figure those out together, and hopefully by the end of the video you'll know why you're doing an ABG. Who does them? Typically, ABGs are going to be done by the respiratory therapist at most facilities. My facility, nurses are allowed to do them. We do them quite often. I like to do them. They're easy personally, but typically respiratory therapy or physicians do them at most hospitals. How do you draw an ABG? I'm not going to go down to the nitty-gritty of exactly how to do it, simply because a lot of facilities, hospitals, have different policies and procedures that dictate how it's done, especially depending on where you come from. So it's important that you follow your hospital's policy and getting it done correctly in the way that they expect it to be done. In the nitty-gritty nutshell version, it's a needle that goes into the artery. Always the radial artery. It could also be the brachial and other arteries, but if it's in the wrist, it's always the radial. The Allen's test you can see here in the bottom, that's going to be a test that you would do prior to performing the ABG to make sure you have good collateral circulation. So you're always going to be poking the radial artery, so you want to make sure that the radial artery has a good collateral with the ulnar. Otherwise, you can cause some serious issues with the circulation to the hand. So you want to make sure that you do perform an Allen's test. Again, I'm not going to go into that. That's how to do one more specifically. Generally speaking, you're putting a needle into an artery, and that's how it's done. How you do it and all the different kind of steps specifically, you're going to want to make sure you cover that in your facility's policies and procedures. So once an ABG is drawn, it's sent down to lab, it's sent down on ice. Ice is used to preserve the specimen to prevent any more cell metabolism from occurring. So you're going to send it down to the lab, lab is going to process it, and it's resulted rather quickly. It's actually important that it's resulted. And you're going to see some values here. So we have arterial blood gases listed on the left. These are normal values. Again, don't study values too much for the NCLEX, guys, because typically with the NCLEX, you're going to see the values given to you, and you're going to have to just kind of, make sure that they're within the normal limits. They're not going to be like, oh, remember the value for this, that, and this, because it does vary depending on the facility that you work for, the location that you are, and things like that. But these are the general values that we're seeing here from a textbook. Generally, we're going to look at the pH. That's the first thing we're going to look at. That's the acidity. So is it acidic or basic? We're going to look at the PCO2. Always look at 2CO2. So carbon dioxide, 2. Di means 2. Dioxide. HCO3 is going to be our bicarb. So dioxide or carbon dioxide is created by the lungs. HCO3 or bicarb is created by the kidneys. So lungs, kidneys. And then PO2. O2 is going to be looking at the oxygen amount. So this is how much oxygen and millimeters of mercury is located inside the blood. So there are different values. A lot of facilities are actually getting away from ABGs. They're moving more towards venous simply because it's easier and it's more comfortable and things like that. But it depends on where you work. You're going to see some things. So when an ABG is drawn, we're going to have to break it down and the easiest way to interpret the ABG. So personally for me, I kind of just look at the whole ABG as a whole. So I like to use a website called ABG Ninja. So this comes up, ABG Interpretation Quiz. This is the website that I used a lot when I was studying for my NCLEX and when I was kind of practicing and being a nurse and how to get better at ABGs. So we're going to evaluate the ABGs in 3 components, and this is actually something that they break out down for you really, really well. So this video, hopefully I can just walk you through this and you can use this website to kind of get better at it. No, I'm not sponsored by this website, but this is a very, very helpful website. They do have different tools here that you can use to kind of learn different types of things, but ABG is what we're going to use. Now we're going to kind of work through this. We're going to get some wrong on purpose and accidentally, of course, because no one is perfect. So the first thing I recommend you do is when you get to this website, you're going to want to know the normal values. So if you click this little box circle thing, it's going to give you the normal range that they expect. What I would do in the beginning is write down this normal range. And it's important that you know what the normal range is that they're looking for. Because again, it's different every different facility, but having the normal range available to you in the beginning allows you to kind of assess where you're at, how you're getting there. So we're going to look at the pH, the PCO2, or carbon dioxide, as we talked about on the previous slide, and then we have HCO3, which is your bicarb, okay? So those are the things that we're going to look at. Now, we're going to have to break it down. So let's say we're going to look at the pH. That's always the first thing you look at. Now, I know there's tic-tac-toe, there's Rome methods, there are things like that. I don't like those kind of methods because it requires too much drawing and things like that. That's just not necessary. So let's look at this. So we're going to look at pH. So first thing you want to ask yourself, is this a high or low pH based off the normal? So if we wrote down our normal values, we know it goes from 7.35 to 7.45. This is 7.53. We know that's high, right? And so with pH levels, we kind of know that low is acidic and high is basic. Okay, both can be bad, not one is better than the other, but low is acidic, high is basic. So we know that this is high. Otherwise, you can also think of basic as alkalotic or alkalosis, and low or acidic as acidosis. So low on the low end of the spectrum here is acidosis, high end of the spectrum is alkalosis. So you can look at it in those ways. So we can look here, the pH is alkalotic or basic. It's quite high. It's a little bit high. It's not terrible, but it's a little bit high here. Okay, so we looked at the pH. Next thing we're going to move on to is the PCO2, or the carbon dioxide amount in the blood. And again, we're going to use a little cheat here, and we're going to know that the normal range for your PCO2 is 35 to 45. Now, we know that CO2 is generated by the lungs when it converts, it brings in oxygen, lets out CO2 in the lungs. So we know this is the lung factor. And we know that the CO2 is a little elevated in this, but not terrible. It's a little bit, but not terrible. And then we're going to look at the bicarb, the HCO3. Bicarb is generated by the kidneys, so that's the kidneys playing a factor in your ABG or into your blood's chemistry. So that's what we're looking at here. We're going to take a look at the little sheet here, and we're going to say, whoa, that's a lot. A lot of bicarb. And right, bicarb is basic. It's a basic bicarb, or alkalotic bicarb. For whatever reason, we have a lot of bicarb. I don't know why, but we do. And that's the thing with ABGs. People want to figure out why. We don't know why. That's not what we're asking. We just know that there's a lot of bicarb. Bicarb is a basic, you know what they say nowadays. So lots of bicarb. So we have lots of basic bicarbs. We have a little bit of acidic carbon dioxide, and we got a basic pH. So right now, primary problem. Is it normal? Well, our pH, is that normal? No. So we know it's not normal. Which one of these is incredibly off? We know that the bicarb is way off. It's way higher. So we're going to go with that's metabolic because that's kidneys, right? It's not the lungs. It's not respiratory. It's kidneys. All right, and then we're going to look at acidosis or alkalosis. Alkalosis or acidosis. So we know based off the pH that this is an alkalosis. It's a very, very high on the, not very, very high, but it's high on the grand scheme of things. This is basic. So we know that they're an alkalosis. Now, partial or full compensation. Now, I'm going to attempt to do this for these videos, but I've never been tested in this, but this video is really good about covering these. So we're going to look at partial or full. So to be fully compensated, you have to have the pH to be normal, and that pH is not normal, so we know we're not fully compensated. So we know right away that it's partially. But how is it being compensated? So it's always opposite, right? So if we know we're in metabolic alkalosis, we're always going to be compensated by respiratory acidosis. It's always going to be opposite, right? It doesn't make sense to be compensated by the same thing. That would just make things worse. And so that's how we're going to figure that out. Let's see if we got it right. And we did. So that's how we figured that out. Now let's kind of break it down a little bit more. So we knew that the patient's overall pH is high, right? 7.53. So they're alkalotic. We knew that from the start. PCO2 is 46, slightly elevated, but not terrible. Bicarb HCO3 was significantly elevated. So their response is the pH and the bicarb are both alkalotic, so the primary mechanism is going to be metabolic alkalosis. The respiratory acidosis is compensation for the bicarb, but the pH is not within normal limits, making it partially effective. Remember what I said, if it was normal pH, it's fully effective. Let's do one more. All right, we're going to look at the pH here. So we have 7.35 pH. That's on the low end, but it's still normal. So we know right off the bat there's nothing too abnormal with the pH. Let's look at the CO2. CO2 is really, really high. I mean, that's pretty high. So why do we have a high CO2? We don't know, but that's pretty high. I would wager a guess this is a COPDer, probably, but we don't know that for sure. But that's a high CO2 level. So we definitely got some acidosis going on here from the lungs. The lungs are not helping us out, but thankfully our pH is normal. So we're compensating really well. Our bicarb from the kidneys, we're going to look at here is 29. It's a little elevated, but remember, it's a basic bicarb. Bicarb is basic. CO2 is acidic. So bicarb balances out the acid, right? It soaks up the acid. It's like a sponge. So we have a little bit of excess bicarb, but that's making us a basic. And it's actually doing a good enough job to keep our pH within normal limits. So we can look at this and which one is causing the problem. I would wager a guess it's the respiratory, right? Because that's way outside the normal limits compared to the bicarb that's just barely outside the normal limits. So we're going to come over here and we're going to go, well, is it normal? No, it's not, because those values are not normal. The only thing normal here is the pH. Everything else is abnormal. Respiratory is definitely the one that's the most abnormal, so we're going to call that the primary culprit of the ABG malfunction. And we know that CO2 causes acidosis, so we're going to call it respiratory acidosis, not alkalosis, because HCO3 or bicarb is a basic bish, right? And so basic is alkalotic. Carbon dioxide is acidic. Okay, so respiratory acidosis. Is it full or partially compensated? Well, simply look back at the pH here and we can see that the pH is within normal limits. And as we talked about, if it's a normal pH, then it's going to be fully compensated. And remember, it's always opposite. So metabolic alkalosis is what causes that. And let's say if we're right. And we're right again. So my friends, this is simple enough. So why is ABG seen to be so terribly complicated? I don't know. And let's look at their result. The pH is at the lower end of normal toward the acidic side, but the bicarb and the CO2 indicate something abnormal is happening. Because the body generally doesn't overcompensate, the acidic factor is the primary culprit. Here there's a respiratory acidosis we talked about, but then the pH is normal means it's fully compensated by metabolic alkalosis. This is a classic chronic COPD gas. That's what I talked about. Remember I said COPD, where over time the CO2 levels lead to high bicarb levels. Alright guys, so this is what we're going to talk about, and this is kind of how ABGs are. I hope this has helped. If you want to see more videos like this, just let me know in the comments down below. Don't forget to like and subscribe, and thanks for checking this out, and I hope to see you in the next video. Thanks guys. Bye.